Daydreaming, also known as mind-wandering or fantasy, is a common phenomenon where thoughts drift away from external tasks to internal musings. Psychologist Jerome L. Singer coined the term daydreaming and laid the groundwork for research in this area. Despite its prevalence, daydreaming lacks a consistent definition among psychologists, though it generally involves mild dissociation. There are different types of daydreams, serving various functions. Mooneyham and Schooler identified 5 potential purposes: future thinking, creative thinking, attentional cycling, dishabituation, and relief from boredom. Daydreaming can help individuals envision future success to motivate themselves, stimulate creativity, switch focus among different tasks, aid in learning by providing mental breaks, and alleviate boredom by mentally detaching from mundane activities. Daydreaming also extends to social scenarios, as humans naturally imagine social interactions. Studies show overlaps between daydreaming and social cognition in brain activity, with a significant portion of daydreams involving social elements. Positive and negative rumination during daydreams can impact mood and perception of future events, especially in individuals with depression. The brain's default mode network becomes active during daydreaming when no external task occupies attention. Various functional theories attempt to explain the mechanisms behind daydreaming, such as distractibility, executive function failure, and decoupling from external stimuli. Daydreaming has been subject to psychological interpretation, with Freudian psychology viewing it as a manifestation of repressed instincts akin to nighttime dreams. Cognitive psychologists like Singer and Incubus developed tools like the Imaginal Processes Inventory to study daydreams, revealing insights into individuals' mental states and creativity. Daydreaming can reveal personal aspects about individuals and be either positive, facilitating self-reflection and creative thinking, or negative, leading to rumination and decreased mood. While it can aid in problem-solving and provide mental breaks, excessive daydreaming may impair performance on tasks requiring sustained attention and comprehension. Despite its costs, daydreaming offers benefits such as internal reflection and emotional processing. Children who develop internal reflection skills through daydreaming tend to perform better academically and have improved social and emotional well-being. Therefore, while daydreaming may have drawbacks, it also plays a crucial role in cognitive development and emotional regulation. Nocturnal sleep-related eating disorder, NSRED, is a unique combination of parasomnia and eating disorder, occurring during non-rapid eye movement, NREM sleep. Unlike night eating syndrome, NES, where individuals are fully awake and aware of their eating, those with NSRED are asleep and unaware of their actions. While the distinction between NES and NSRED is primarily based on consciousness levels during eating episodes, both disorders share similarities in symptoms, such as frequent nocturnal binging. Patients with NSRED exhibit distinct behaviors during episodes, including partial arousals from sleep followed by rapid or uncontrolled ingestion of food. These episodes often involve consuming unusual or even harmful substances, such as glue or wood. Additionally, individuals may display messy or hazardous eating habits, leading to injuries. Diagnosis of NSERED is based on criteria outlined by the International Classification of Sleep Disorders 3rd edition, ICSD-3, which include dysfunctional eating during the main sleep period, ingestion of unusual or toxic substances, and negative health consequences. Unlike NES, patients with NSRED may be injured during episodes and have no recollection of them due to lack of consciousness. Treatment for NSRED varies, with psychotherapy combined with environmental manipulation being one approach. However, this method has shown limited success, with many patients experiencing depression and anxiety. Medications such as pramipexole and topiramate have been investigated, showing some efficacy in reducing nocturnal eating episodes and promoting weight loss. Historically, NSRED was first reported in 1955, but it remained poorly understood until further studies by Schenk and Mahowald in the 1980s and 1990s. Their research revealed important distinctions between NSRED and NES, highlighting the prevalence of NSRED among women and its association with weight gain. Despite advancements in understanding NSRED, effective treatment options remain limited, underscoring the need for further research in this area. Sleeping while on duty, or sleeping on the job, is typically viewed as misconduct and can lead to disciplinary action, including termination. However, recent studies have highlighted potential health and productivity benefits of napping at work, leading some employers to provide facilities for employees to do so. Despite this, the issue remains contentious, with concerns over productivity, professionalism, and safety. The frequency of sleeping while on duty varies, with daytime workers more likely to take short naps and graveyard shift workers sometimes sleeping for extended periods. Surveys indicate that a significant portion of employees have admitted to sleeping on the job, with poor sleep quality impacting work performance for many. Employers have differing views on sleeping at work, with some implementing policies to allow napping breaks to improve productivity, while others strictly enforce rules against sleeping on duty. In certain industries, such as aviation and transportation, falling asleep while on duty can have severe consequences, including legal sanctions and loss of licenses. Despite the stigma associated with sleeping at work, some industries and cultures permit and even encourage it as a sign of dedication. Notable incidents involving sleeping on duty have occurred in various professions, including airline pilots, air traffic controllers, bus drivers, police officers, and security guards. From airline pilots overshooting airports due to mid-flight naps to security guards caught sleeping on duty at nuclear power plants, instances of sleeping while on duty have highlighted the potential risks and consequences associated with this behavior. Diphenhydramine, commonly known as Benadryl, is an antihistamine and sedative used to treat allergies, insomnia, and symptoms of the common cold. It can be taken orally, injected, or applied topically, with effects typically lasting up to 7 hours. While it's generally safe, common side effects include sleepiness, poor coordination, and stomach upset. However, its use is not recommended for young children or the elderly due to potential risks. Originally developed in 1946 by George Revachol, diphenhydramine is widely available as a generic medication and under various brand names. It's commonly prescribed with over 1 million prescriptions in the United States in 2021. Beyond its primary medical uses, diphenhydramine has sedative properties that have led to some cases of recreational use, although it can be dangerous at high doses. In the medical field, diphenhydramine is used to treat allergic reactions, motion sickness, and insomnia. It's also effective in managing itching, with topical formulations causing fewer systemic effects than oral forms. Additionally, diphenhydramine is utilized to treat movement disorders like akathisia and Parkinson's disease-like symptoms caused by certain medications. Despite its sedative effects, diphenhydramine is commonly found in non-prescription sleep aids. However, its effectiveness for insomnia treatment is debated, with some guidelines recommending against its use due to limited evidence. Misuse of diphenhydramine to sedate children or passengers on long flights is discouraged due to potential risks and side effects, including paradoxical reactions and decreased ability to respond to emergencies. Hypnagogic hallucinations occur as you're falling asleep and are common, affecting up to 70% of people. These hallucinations involve false perceptions of objects or events, including sight, sound, smell, touch, and taste. They typically manifest as visual experiences, such as changing geometric patterns, shapes, or flashes of light, resembling a kaleidoscope. Additionally, they may include sensations like bodily distortions, feelings of weightlessness, or hearing sounds or voices. While they're often harmless, hypnagogic hallucinations can be associated with sleep disorders like narcolepsy or certain health conditions. Distinguishing between hypnagogic hallucinations and dreams is important. Dreams usually have a storyline, whereas hypnagogic hallucinations are brief and lack narrative structure. Upon waking from a dream, there's immediate awareness of having dreamt, whereas hypnagogic hallucinations occur while still awake, albeit nearly asleep, causing confusion about reality. The exact cause of hypnagogic hallucinations isn't fully understood, but they share similarities with daytime hallucinations and dreams. While they're generally harmless, They can be more common in individuals with sleep disorders, mental health conditions, or those taking specific medications like tricyclic antidepressants. Anxiety typically doesn't directly cause hypnagogic hallucinations, but frequent or disturbing hallucinations can lead to anxiety or sleep-related anxiety. If experiencing distress due to hypnagogic hallucinations, consulting a healthcare provider is advisable. Treatment may involve managing sleep patterns, avoiding certain substances, or adjusting medications. Healthcare providers can also assess if hallucinations indicate an underlying health condition, such as narcolepsy, requiring tailored treatment. World Sleep Day is an annual event organized by the World Sleep Society to celebrate the importance of good sleep and raise awareness about sleep disorders. It occurs on the Friday before the Northern Hemisphere vernal equinox and aims to highlight the medical, educational, and social aspects of sleep. Sleep deprivation is a significant issue worldwide, with the US alone estimated to lose over $400 billion annually due to sleep-related problems. Other countries like Japan, Germany, the UK, and Canada also face substantial economic losses due to sleep deprivation. Critics argue that events like World Sleep Day contribute to the commodification of sleep and promote the idea of a single uninterrupted block of sleep, which historians claim is a recent societal construct. Since its inception in 2008, World Sleep Day has been observed annually with various events, discussions, and educational activities held globally and online. Each year, a different slogan is chosen to emphasize different aspects of sleep health and well-being. The slogans over the years have focused on themes like the importance of sleep for overall health, safety while driving, healthy aging, easy breathing, and promoting a better quality of life through better sleep habits. In 2022, the theme, Quality Sleep, Sound Mind, Happy World, emphasizes the connection between sleep quality and mental well-being, reflecting the ongoing efforts to promote better sleep habits for a healthier and happier global population. Jet lag is a condition that occurs when rapid long-distance travel disrupts the body's circadian rhythms, leading to symptoms like sleep disturbances, fatigue, and cognitive impairment. It affects travelers crossing multiple time zones, with recovery typically taking about 1 day per time zone crossed. The term jet lag originated with the advent of passenger jet aircraft, as slower modes of transportation did not cause the same desynchronisis. Aviator Wiley Post was one of the first to write about the effects of flying across time zones in the 1930s. Symptoms of jet lag can include sleep disturbances, cognitive impairment, dizziness, nausea, fatigue, headaches, and changes in digestion. These symptoms arise from the body's internal clock being out of sync with the new time zone. Jet lag management strategies include timed light exposure, melatonin administration, and adjusting sleep schedules before departure. Short-term use of hypnotic medications can also help reduce insomnia related to jet lag. Jet lag can have mental health implications, particularly for individuals with affective and psychotic disorders. Disruptions to circadian rhythms have been linked to increased risk of relapse in these populations. It is a complex physiological phenomenon that can significantly impact travelers' well-being, especially those who frequently traverse multiple time zones. Sleep deprivation, also known as sleep insufficiency or sleeplessness, is the condition of not having adequate duration and/or quality of sleep to support decent alertness, performance, and health. It can be either chronic or acute and may vary widely in severity. All known animals sleep or exhibit some form of sleep behavior, and the importance of sleep is self-evident for humans, as nearly a third of a person's life is spent sleeping. The average adult needs to sleep for 7 to 8 hours every 24 hours, and sleep deprivation can occur if they do not get enough sleep. Acute sleep deprivation is when a person sleeps less than usual or does not sleep at all for a short period of time, normally lasting 1 to 2 days, but tends to follow the sleepless pattern for longer with no outside factors in play. Chronic sleep deprivation is when a person routinely sleeps less than an optimal amount for optimal functioning. Chronic sleep deficiency is often confused with the term insomnia. Although both chronic sleep deficiency and insomnia share decreased quantity and/or quality of sleep as well as impaired function, their difference lies in the ability to fall asleep. To date, most sleep deprivation studies have focused on acute sleep deprivation, suggesting that acute sleep deprivation can cause significant damage to cognitive and emotional functions and brain mechanisms. Sleep-deprived people are able to fall asleep rapidly when allowed, but those with insomnia have difficulty falling asleep overall. The amount of sleep needed can depend on sleep quality, age, pregnancy, and level of sleep deprivation. Insufficient sleep has been linked to weight gain, high blood pressure, diabetes, depression, heart disease, and strokes. Sleep deprivation can also lead to high anxiety, irritability, erratic behavior, poor cognitive functioning and performance, and psychotic episodes. A chronic sleep-restricted state adversely affects the brain and cognitive function. However, in a subset of cases, sleep deprivation can paradoxically lead to increased energy and alertness. Although its long-term consequences have never been evaluated, sleep deprivation has even been used as a treatment for depression. Few studies have compared the effects of acute total sleep deprivation and chronic partial sleep restriction. A complete absence of sleep over a long period is not frequent in humans unless they have fatal insomnia or specific issues caused by surgery. It appears that brief microsleeps cannot be avoided. Long-term total sleep deprivation has caused death in lab animals. Insomnia affects 21 to 37% of the adult population. Many of its symptoms are easily recognizable, including excessive daytime sleepiness, frustration or worry about sleep, problems with attention, concentration, or memory, extreme mood changes or irritability, lack of energy or motivation, poor performance at school or work, and tension headaches or stomach aches. Insomnia can be grouped into primary and secondary or comorbid insomnia. Primary insomnia is a sleep disorder not attributable to a medical, psychiatric, or environmental cause. There are three main types of primary insomnia: psychophysiological, idiopathic insomnia, and sleep state misperception, paradoxical insomnia. Secondary insomnia, or comorbid insomnia, occurs concurrently with other medical, neurological, psychological, and psychiatric conditions. Sleep deprivation is known to be cumulative. This means that the fatigue and sleep one lost as a result of, for example, staying awake all night would be carried over to the following day. Not getting enough sleep for a couple of days cumulatively builds up a deficiency and causes symptoms of sleep deprivation to appear. A well-rested and healthy individual will generally spend less time in the REM stage of sleep. Studies have shown an inverse relationship between time spent in the REM stage of sleep and subsequent wakefulness during waking hours. Short-term insomnia can be induced by stress or when the body experiences changes in environment and regimen. Sleep apnea is a serious disorder that has symptoms of both insomnia and sleep deprivation, among other symptoms like excessive daytime sleepiness, abrupt awakenings, and difficulty concentrating. Those with sleep apnea may experience symptoms such as awakening gasping or choking, restless sleep, morning headaches, morning confusion or irritability, and restlessness. This disorder affects 1 to 10% of Americans. It has many serious health outcomes if left untreated. Positive airway pressure therapy using CPAP, continuous positive airway pressure, APAP, or BPAP devices is considered the first-line treatment option for sleep apnea. Sleep deprivation can sometimes be self-imposed due to a lack of desire to sleep or the habitual use of stimulant drugs. Consumption of caffeine in large quantities can have negative effects on one's sleep cycle. While there are short-term performance benefits to caffeine consumption, overuse can lead to insomnia symptoms or worsen pre-existing insomnia. Consuming caffeine to stay awake at night may lead to sleeplessness, anxiety, frequent nighttime awakenings, and overall poorer sleep quality. The specific causal relationships between sleep loss and effects on psychiatric disorders have been most extensively studied in patients with mood disorders. Shifts into mania in bipolar patients are often preceded by periods of insomnia, and sleep deprivation has been shown to induce a manic state in about 30% of patients. Sleep deprivation may represent a final common pathway in the genesis of mania, and manic patients usually have a continuous reduced need for sleep. Chronic sleep problems affect 50% to 80% of patients in a typical psychiatric practice, compared with 10% to 18% of adults in the general U.S. population. Sleep problems are particularly common in patients with anxiety, depression, bipolar disorder, and attention deficit hyperactivity disorder, ADHD. The symptoms of sleep deprivation and those of schizophrenia are parallel, including those of positive and cognitive symptoms. The U.S. National Sleep Foundation cites a 1996 paper showing that college/university-aged students get an average of less than 6 hours of sleep each night. A 2018 study highlights the need for a good night's sleep for students, finding that college students who averaged 8 hours of sleep for the 5 nights of finals week scored higher on their final exams than those who did not. In the study, 70.6% of students reported obtaining less than 8 hours of sleep, and up to 27% of students may be at risk for at least one sleep disorder. Sleep deprivation is common in first-year college students as they adjust to the stress and social activities of college life. A study performed nationwide in the Netherlands found that general ward patients staying at the hospital experienced shorter total sleep, more nighttime awakenings, and earlier awakenings compared to sleeping at home. Over 70% experienced being woken up by external causes, such as hospital staff. Sleep deprivation is even more severe in ICU patients, where the naturally occurring nocturnal peak of melatonin secretion was found to be absent, possibly causing the disruption in the normal sleep-wake cycle. However, as the personal characteristics and the clinical picture of hospital patients are so diverse, the possible solutions to improve sleep and circadian rhythmicity should be tailored to the individual and within the possibilities of the hospital ward. A study published in the Journal of Economic Behavior and Organization found that broadband internet connection was associated with sleep deprivation. The study concluded that people with a broadband connection tend to sleep 25 minutes less than those without a broadband connection. Hence, they are less likely to get the scientifically recommended 9 hours of sleep. Another study conducted on 435 non-medical staff at King Saud University Medical City reported that 9 out of 10 of the respondents used their smartphones at bedtime, with social media being the most used service. The study found participants who use their smartphone at bedtime to be 78% more likely to report poor sleep quality and 48% more likely to report sleep deprivation compared to those who did not. There are numerous potential causes of sleep deprivation, including stress, excessive work hours, shift work, obesity, and more. Addressing the underlying cause of sleep deprivation is crucial to improving sleep quality and overall health. Nitrous oxide, also known as laughing gas, is a chemical compound used for various purposes, including medical, recreational, and industrial applications. It's famous for its euphoric effects when inhaled, hence the nickname laughing gas. But it also serves critical roles in surgery, dentistry, and even rocket propulsion. In medicine, nitrous oxide is utilized as an anesthetic and analgesic, helping to alleviate pain and induce relaxation during procedures like dental work and childbirth. Its use dates back to the mid-19th century when it was first demonstrated as an anesthetic agent. Beyond medicine, nitrous oxide has industrial applications, such as in rocket propulsion systems, where it serves as an oxidizer. It's valued for its stability and effectiveness in enhancing engine performance. However, recreational use of nitrous oxide has become a concern due to its potential for neurotoxic effects, especially when abused. Excessive inhalation can lead to neurological damage, particularly through inactivation of vitamin B12. Furthermore, nitrous oxide poses risks to occupational health, particularly for medical professionals who may be exposed to it during procedures. Poor ventilation can lead to prolonged exposure, resulting in intoxication and impairment. Despite its diverse uses and potential benefits, the safety and responsible handling of nitrous oxide are essential considerations in various industries and recreational settings. Awareness of its effects and risks is crucial for promoting safe usage and minimizing harm. Recurring dreams, experienced repeatedly over a long period, can offer intriguing insights into the human psyche. Through psychological analyses and studies, common themes have emerged, ranging from being chased to teeth falling out. While these themes vary widely, they often reflect underlying psychological processes or unresolved conflicts. Possible explanations for recurring dreams abound, each offering a unique perspective on their significance. The threat simulation theory suggests that these dreams serve a biological function by simulating threatening events and rehearsing avoidance behaviors. Conversely, the Gestaltist dream theory posits that recurring dreams reflect a person's current state of psychic imbalance, offering an opportunity for self-restoration. Freudian theory views them as expressions of neurotic, repetitive compulsions, while Jungian theory sees them as vital for integrating different aspects of the psyche. Culturalist dream theory adds another layer of interpretation, suggesting that recurring dreams symbolize events or situations that are bound to occur without positive change in one's personality. Finally, lucid dream theory proposes that experiencing recurring dreams is a normal phenomenon, with some individuals naturally dreaming in a recurrent form. Understanding recurring dreams involves not only exploring their possible explanations, but also considering the individual's unique experiences and psychological makeup. By delving into these dreams, we can uncover valuable insights into the complexities of the human mind and the subconscious processes at play. Myoclonus, characterized by brief involuntary muscle twitching, can occur during muscle contractions, positive myoclonus, or lapses of contraction, negative myoclonus. Often experienced while falling asleep, these twitches are common but can also indicate underlying neurological disorders. Hiccups are a form of myoclonic jerk affecting the diaphragm. Myoclonus may vary in frequency, duration, and pattern, occurring in isolation or sequences with or without identifiable triggers. It can accompany various nervous system disorders like multiple sclerosis, Parkinson's disease, and epilepsy, often manifesting after other neurological symptoms. Types of myoclonus include cortical reflex myoclonus, essential myoclonus, and juvenile myoclonic epilepsy. These forms differ in their origin, severity, and associated conditions, ranging from benign to debilitating. In reflex epilepsies, myoclonic seizures can be triggered by external stimuli like flashing lights. These seizures, characterized by sudden involuntary muscle contractions, are common in individuals with epilepsy and can distort movement and daily activities. Myoclonus can stem from various causes, including neurological conditions, brain injuries, strokes, infections, and medication side effects. Treatments focus on addressing underlying conditions and may include multiple drugs or surgical interventions for severe cases. Prognosis varies depending on the form and overall health of the individual, with severe cases potentially limiting normal functioning. Research supported by organizations like the National Institute of Neurological Disorders and Stroke aims to understand the role of neurotransmitters and genetics in myoclonus to develop better treatments and diagnostic tools. Many believe that dreams offer insights into our subconscious, with objects like mirrors carrying symbolic significance depending on their portrayal. It's believed that when you see someone else in the mirror, it suggests a disconnect with your own identity, possibly due to personal changes or external influences. If the reflection is someone you know, it may indicate a loss of personal power or identity to that person. A mirror with no reflection hints at struggles with self-identity, especially during times of change or conformity to others' beliefs. Seeing yourself in the mirror signifies a need for self-reflection, with contentment or self-centeredness depending on your reaction to the reflection. Strange images in the mirror suggest hidden emotions needing attention, urging introspection and emotional processing. Broken mirrors symbolize distorted self-image or personal growth through shedding negative habits. Steamed-up mirrors denote confusion or strained relationships, while dirty mirrors represent hindrances to self-awareness. Different types of mirrors offer varied interpretations. Hand mirrors reflect self-consciousness, bathroom mirrors signify self-reflection time, and rearview mirrors caution against dwelling on the past. Dentists' mirrors hint at relationship difficulties or trust issues, while large mirrors symbolize the desire for a broader perspective on life. Actions involving mirrors also hold meaning. Buying a mirror prompts self-reflection, while receiving one reflects expectations from others. Cleaning a mirror indicates character growth or repayment for past favors. Breaking a mirror, whether accidentally or deliberately, symbolizes upcoming bad luck or breaking away from negative habits. A falling mirror signifies a desire for change or letting go of past burdens. Mirror dreams prompt introspection and self-awareness, offering insights into our emotions and actions. While dream interpretation may not be exact science, it provides a pathway for understanding our desires and navigating life's challenges.
Like this video and subscribe to Maker.